Hey everybody, this is Luke Gordon, physical therapist, and today's topic is how to fix rotator cuff tendinosis. So I just finished a couple videos about what is supraspinatus tendinosis and infraspinatus tendinosis, where I basically explained those two rotator cuff muscles. If you have an MRI, a lot of times you'll have that term show up, and what does it mean? So if you've watched those videos, the next logical question is then how do you fix it? If you have an MRI and you have supraspinatus tendinosis, what are you supposed to do about it? And I mentioned in those videos, do you need an injection? Will physical therapy work, or do you need surgery? So I'm going to walk you through kind of how to decide that first of all, and then if physical therapy is a good option, I'm going to walk you through what I call the 3 phases of recovery and just kind of show you what to do and what not to do, some mistakes to avoid and stuff like that. So again, how to fix it. Do you need an injection? Do you need PT? Do you need surgery? Let's tackle that one first. So first off, the average person with tendinosis in the supraspinatus, infraspinatus, just a general rotator cuff tendinosis, they don't need surgery in general. Now, if you have a massive tear along with it or something like that, maybe. So obviously I'm a little bit biased because I am a PT, but I would default to saying do everything you can conservatively, meaning PT, massage, chiropractic, whatever, but I think PT is especially relevant for rotator cuff issues. Do everything you can conservatively to first off avoid an injection, and then to second, of course, avoid surgery. So if you haven't had an injection yet, great. I wouldn't leap right to it. I would do physical therapy first. If you have had an injection, you could certainly do physical therapy now. So if you're doing physical therapy then for your tendinosis, what's the approach that you want to take? That's what I really want to walk you through in today's video. So what I think this fits nicely into what I call the 3 phases of healing, which basically just means step 1 is to reduce pain, step 2 is to improve strength and flexibility, and step 3 is to return to all of the important functional activities, whether you're like an overhead athlete or you're in the gym working out, or you just want to be able to reach up like into your cupboard or sleep on your right shoulder or throw a ball to your dog. Whatever it is, just returning to those activities. So let's walk through that a little bit then. So in the first phase, which I think is really important for this, is you just want to get rid of as much pain, and I wouldn't call it necessarily inflammation because it's not quite inflammation the same way like a tendinitis is, but pain, any inflammation, I mean, it's relevant. You just want to get rid of the pain though. That's phase 1. So that's why it's in red on my chart here. Phase 1 is get rid of the pain. Now with tendinosis, the way that you want to get rid of pain is you want to get extra blood flowing to those tissues. One of the hallmark signs of tendinosis is that the tendon is no longer inflamed. It's actually almost like it's gotten forgotten by your body. Forgotten, you know how that is, but it's forgotten, and there's less blood flow to the tissue. So if you have a supraspinatus tendinosis and it's up here in your shoulder underneath these bones here, you need more blood flow to that area in order to heal the tissue. The tissue again is showing up on your MRI, and there's scar tissue, there's fatty tissue. It's just not good quality tissue anymore. So one of the processes to get the pain level down is increase the blood flow. That comes in with like doing types of friction massage. A lot of hands-on techniques is what I really encourage people to do in phase 1. Hands-on massage, different taping techniques, different things you can do to get the blood flowing, like using heat. You can still use ice if it's really inflamed for whatever reason, but heat is a good one. So that is phase 1. Again, that's the red phase here. You don't necessarily want to jump right into strengthening early on, but if you do, it should be very well tolerated, and it shouldn't be that stressful. So that's phase 1. Let's get the pain level down, get the blood flowing, break up some scar tissue if there is some, use some taping techniques, things like that. And then we can start to shift into phase 2, where now we're going to start working on strengthening. This is when you should also start working on improving your posture if there's a postural issue, or any mechanical issues in like your technique and things like that, which I think this is where it's really valuable to work with a skilled therapist. For the pain reduction as well, but also for correcting all of your postural issues and getting into strengthening. The most important aspect to keep in mind during phase 2 is that you want pain-free strengthening for the most part. With tendinosis, you can dabble into pain a little bit because you're trying to improve the blood supply at the same time. You just have to be careful not to inflame the tissue too much. So that's phase 2. The one thing I want to mention too with this is that with any type of tendinosis, whether it's rotator cuff, or it's Achilles tendinosis or any of these other tendinosis of these major tendons in your body, is that eccentric strengthening can be a really valuable part of your rehab recovery, especially again with tendinosis versus tendinitis. I don't have any specific videos yet on how to do eccentric rotator cuff strengthening yet, but I'm planning to do that soon, so keep an eye out for that, and if I can, I'll come back and link it to this video. So keep that in mind. Strengthening is phase 2. That's how you want to improve the blood supply. And then as you're strengthening the muscles, it's putting that pressure on the tissues and the fibers of the muscles to pull them in the right direction to help heal the tendinosis. So overall, that's our goal. Let's heal the tendinosis, get the tissue back to where it used to be, looking nice, looking healthy, good blood supply, and then let's build the strength. And again, if there's underlying postural issues, mechanical issues, let's fix those along the way too. And then as we get into phase 3, then we're going into those specific activities. If you are doing stuff overhead, it's going to include specific overhead type strengthening, functional strengthening, other types of strengthening that we do as PTs to access like the neurological components of muscular stability, because ultimately you want dynamic control, dynamic stability and strength of your shoulder. So again, I'm not going to jump into all of that in today's video, but that's how you want to approach fixing rotator cuff tendinosis. Get the pain down, increase the blood supply, overall with the goal of improving the strength, getting the tissue to heal, and then returning to all the activities that you like to do. So that's it for today's video. Like I said, I've got more videos to make on the subject, and I'll be releasing those kind of over the coming weeks and months here. But for now, thank you for watching. Please like the video, leave me a question or comment below, and I'll get back to you as quickly as I can. And I really hope that this video helps. Thanks again for watching.